Welcome to The Digital Patient, where we discuss the latest advancements in digital patient engagement and share stories from the front lines. I'm your host, Sardana, and with me as always is SeamlessMD CEO, Dr. Joshua Liu. Today we're joined by our very special guest, Tom Andriola. Mr. Andriola is currently the Vice Chancellor for Information, Technology, and Data, and Chief Digital Officer at UC Irvine. Today, in addition to his work as Chief Digital Officer, he remains active in higher education and healthcare, serving on various boards and advising startups. Mr. Andriola, Tom, welcome to the show.
Thank you, Alan, for having me.
It's absolutely an honor to have you on the show today. You've had such a dynamic career all over the world. You've been on all sides of the healthcare table and have led teams within the broader institutions, leading IT. And today, like I mentioned in the bio, you're the Chief Digital Officer at UC Irvine with a portfolio that spans UCI research, education, and healthcare. So I was wondering if you could take us back. Why did you get into engineering and technology and startups to begin with?
Well, it's an interesting question, right? Because at 18 years old, there's a lot about the world you don't understand. We can admit that now that we're growing up, but you have people lead you down certain paths, or they share things with you. And for me, engineering was something my father really pushed because it was something that he saw opportunity pass him by, not having a degree like that. And so he wanted his son to have better opportunities. I think that pushed me down engineering. It took me a while to find the discipline in engineering, though, that kind of fit me, which was kind of more mathematics based, which then brought me to mathematics, statistics, and a little bit of computer science. But then it was industry where I got really introduced to, let's call it technology, and what technology was then doing for organizations. I came out at a time when IBM was the big player on the block. Apple was really small and only did one thing, which was these little innovative computer desktops. What I learned very quickly was that technology was always about creating what was going to be happening next in our world. Being someone who's always very interested in innovative and creating something new or better, I found myself kind of trending towards those types of opportunities. So engineering can give you a foundation, but it was really my practicum during my education and then what I did after that found me into the technology field, which has been a very dynamic field in all those years.
Yeah, absolutely. And I noticed early on in your career, you actually got into healthcare through a startup. What kind of pushed you towards healthcare?
Yeah, it was kind of a startup and kind of let's call it a corporate startup. We were going through the last great technology change, which was the introduction of the internet. And I was one of those, talk about things come and go. I had a business card that said I was an e-business consultant, right? How ridiculous does that sound today, right? But the internet was this thing that everyone was trying to figure out what's it going to mean to my business, kind of like what's going on in the world today with the topic being AI. And I was working for a firm that really wanted to be front and center on this with their clients. And we started working with an established medical device company that was asking those questions. And so we came in and kind of worked alongside to build a digital strategy and trying to figure out what is that going to need to look like? And is it part of the business? Is it kind of alongside the business? Is it something that we would spin out? And so it really kind of at the intersection of strategic thinking leads into business. And that led into all the conversations you started to talk about startup, which is like, where's the value proposition? How do you disrupt it? How do you get in front of the customer and start to shape what they value to be more important? And so kind of led me to have these types of roles I call intrapreneur, right? I tell people I started businesses, but I've never started my own company. That's different, right? And you do a lot of the same things, but there's things you do when you're an entrepreneur where you start your own company and you have to set it up, and it's external funding versus internal funding. So I've always kind of been on this, very kind of entrepreneurial track where I'm the person who is kind of chosen to figure out where do we need to go to create the competitive advantage for our company, right? Or to save our company in some of those cases.
In terms of healthcare, some folks would say it's far more complicated, far more frustrating to innovate and disrupt. And so I know a lot of folks who just have been on the healthcare track since the early age, and so they're just healthcare lifers. It's kind of less common to start in tech and then somehow convince yourself to do healthcare despite all the challenges. So even once you got the taste of it, what do you feel like kept you on that path since then?
Yeah, I think it's because there's so much opportunity. One is it's not that there's not innovation, right? There's actually a lot of innovation. I think there's a couple of challenges. The innovation comes with a strong regulatory environment that, let's say, sets the pace for how fast innovation will come in. And then the second part is what's at stake, right? It's really different when we have an innovation that might change where I might buy my next pair of shoes, right? If I buy a bad pair of shoes, I might be out a couple of dollars. If I make a bad healthcare decision, I might cost someone their life, right? Or a healthy, productive, autonomous life. And so what's at stake also kind of regulates, kind of how fast some of the innovations go from a standpoint of the person who says, I'm going to accept a new way of doing it. And so the bar is pretty high then in terms of, it needs to be a no compromise solution because healthcare doesn't accept compromises very well. It has to be clearly better and demonstrated through evidence. And so those, let's call them regulators on the innovation cycle, just means things move at a little different pace versus if you're just in a plain old consumer world where, the switching costs and are very, very low in comparison. But I find it very dynamic. It comes from healthcare innovators or people who have medical training backgrounds who jump in and they bring a deep insight of the understanding of the biology or the understanding of the patient, people coming from outside who have innovative ideas who really kind of figure out a way to disrupt the value chain. So I think that's one of the things that's more dynamic is there's pressures from a lot of different places. It could be from the delivery side, but also could be from the innovation is coming from the payer side and forcing changes in the way that delivery organizations behave. So I think that ecosystem is pretty dynamic in terms of the innovation. It's just not as fast as other industries.
Today's episode is brought to you by SeamlessMD, which enables health systems to digitize patient care journeys, leading to lower lengths of stay, readmissions, and costs. Josh, you used to be a doctor. Did you ever feel like patients showed up unprepared for surgery? Or maybe you felt like you were sending patients into a black hole after discharge?
All the time. We give patients paper and verbal instructions, which are so easy to forget and really hard to follow. And we have no idea what happens to them outside the hospital. So what happens? Well, because we worry about them, we keep patients in hospital longer, but that drives up length of stay and lowers throughput. Plus, after they leave, patients get readmitted for infections and all kinds of problems that we could have just caught earlier if we monitored patients.
What if I told you there was a way to give every patient a virtual companion so you could automatically engage and monitor them through a surgery, a cancer journey, or a chronic care journey, and drop the length of stay, increase throughput, and lower readmissions?
Gosh, Alan, that would be amazing.
So that is exactly what SeamlessMD does. It allows health systems to engage patients on their own phone, tablet, or computer with automated reminders, education, and symptom monitoring. Basically a GPS through any healthcare journey.
That sounds fantastic, but does it actually work?
It does. Health systems have done over 40 studies and evaluations showing how they use the solution to reduce length of stay by 1 to 2 days, readmissions by up to 89%, and costs by over $1,000 per patient.
Huh, but how does that work with my EHR?
That's the best part. SeamlessMD is the only solution in this space with direct integration partnerships with Epic and MyChart, Oracle Cerner, and Meditech.
Huh. Well, I am getting a colonoscopy soon, so I really need something like this. Where can my health system learn more?
Well, Josh, thanks for letting me know. Your health is very important, and endoscopy is just one out of the 50+ out-of-the-box care plans available today on SeamlessMD. Go to www.seamless.md. That's www.seamless.md to learn more. Early on in your career, you worked for Philips and became the general manager for different businesses on 4 different continents. And I've heard you share in the past how success in one market doesn't necessarily translate to other markets, and you experienced culture shock and had to adapt your leadership and communication styles. What piece of advice would you give to your younger self today to make a transition with a new team, especially with different cultures, better or more graceful?
You mean besides chill out?
Yeah.
No, so I think, if I had to go back and say, it would be to listen more and really take time to get a broad set of perspectives before choosing direction. I think earlier in my career, too quick to think I knew the answer versus seek out and let the answer define itself through, a broad set of diverse perspectives. And I had some really good mentors in Philips as they pushed me into some of these roles. They saw my let's say, my blind spots and would challenge me around those blind spots as they push me into the next challenge, right? And I think I was always driven by, I wanted the next challenge, right? It's like, got to the top of this hill, this is awesome, see the view, where's the next hill? And I mean, that's just kind of the way I'm wired. But I think the people were saying, hey, we got the next hill for you. We want to point a couple of things out. It was really important to get that feedback because it allowed me then at least the opportunity to reflect on approach. So then rounding that out then almost like gave me a playbook to be able to, well, maybe better than maybe it's a toolkit to then build a playbook that was unique to the different situations that I ultimately got dropped into. And I think that's what ultimately has kind of served me well is that toolkit has gotten broader and right. Every time you get a new experience, it puts one or two new tools in there. And Philips was a great organization because they wanted you to be a senior executive. They required you to have a 2x2x2 matrix that you checked off for that, meaning that you had worked with two different businesses in two different functions on two different continents. That was their goal and what they wanted for people that they were kind of trying to get to that executive level. Because they had a philosophy that only people who had that variety of experiences had enough perspective to run global businesses. So that really worked in terms of helping me be a well-rounded, not only business leader, but I think also like manager of an organization, because it gave me a set of experiences where I understood that people were going to come from different places, having different cultural backgrounds. One of the teams I ran in Europe, I mean, we had like people came from 9 different parts of the world on one single management team. And one of the things that we did is we actually put everyone on that management team through cultural training, just to try to understand how we all communicated with each other. Because, you have Germans and you had Americans and you had Indians and you had Dutch people. And it was like, we were just a mishmash, all really good at what we did. But our biggest challenge was being able to communicate with each other. And so we did something that was very, very kind of not typical, which is we brought in a cultural consultant to help us work on our ability to operate as a functional team. Those type of experiences and those type of feedbacks to me gave me the opportunity to become well-rounded.
So Tom, as the Chief Digital Officer at UC Irvine, you're kind of a unique position where you're leading digital transformation across not just healthcare, but education and research. Because I think most of the digital leaders Al and I speak to are really focused on one domain. I'm kind of curious, having experienced all three of those now, what would you say is similar and different when it comes to change management for bringing digital in those three different domains?
Yeah, I think a couple of things that are definitely the same and different. One is that you deal with the challenge of change with this kind of high subject matter expert who's in a position of a lot of authority around decision. Right? It's the clinician in the healthcare setting, right? But you have the same thing with the professor in the classroom and the principal investigator in the research lab. And so when you have this kind of, deep subject matter expert, you have this, kind of, how do you really get a person who's kind of positioned in that way, so critical to the value proposition to make a switch? And that kind of challenge and really the change management toolkit that I've learned over the years kind of really understands that challenge. And I would say it brings similar approaches in terms of how we try to convert and bring innovation to scale. I think when you start getting a little lower and you say, so what's different? In healthcare, it's innovation moves at a pretty slow pace. In education, sometimes people say, well, it works even slower. And it's like, it actually runs faster. But the distribution, I always think in terms of distribution, right? So the technology adoption curve, it's actually called the innovation adoption curve that we all think about, like, bleeding edge, early adopters. That actually comes from agricultural time in our history. It was developed in agriculture in terms of how new technology was affecting agriculture when we were an agrarian economy here in the US. But that curve we still use today for technology adoption. And I always look at that. And what I say is that, one of the things that, in education that's really different is the distribution. The future's already here. It's just unevenly distributed. So we have professors teaching in, the metaverse, but we also have professors who we're still trying to get them off their whiteboards, right? And so you just deal with those two different, kind of ends of the spectrum, and in healthcare, it's not quite as bad, I think. So there are similarities. And so that's where some of the cross-pollination opportunities come. We're going through that right now with the whole AI, where we've identified different tracks in AI, one in teaching, one in research, one in operations of a university campus, one in patient care, one in running a health system, one in industry collaboration. And we're trying to figure out where's there a commonality foundation that we can build that every one of those lanes will use, and where do the lanes start to get unique to the different type of value proposition for the mission of the university.
Well, Tom, today you are laser focused on being, thinking, and operating as a data company. I've heard you say that in the past. Over the past few years, you've launched several data as a strategy initiatives to reduce the friction, like you're saying, between the flow of data and really create value for the system. Which initiative are you most passionate about today and think maybe there will be long-term effects positive in the future?
So I would say the first thing is that there's been an ongoing effort to try to help people understand that every company is a data company. And because you're a data company, you're actually an AI company. We really start thinking that way. So there is a mental shift that comes with my role of trying to get people to really understand what business we're in, and we're actually in the data business. Think about what a university with a health system does is we create knowledge through the research engine and we put that knowledge into practice. What is knowledge? Knowledge is data that is organized information that becomes usable in some way, shape, or form, right? So we are a data organization, right? We are a data business. So you got to get people's head wrapped around a different way of thinking. Also, because we're a data company, we should think to solve problems through our data, not by throwing people at solving problems. That's a shift for a lot of organizations, including ours, which is thinking about technology and data are where we're looking for first to get to a better place, rather than let's hire X number of new people, because quite honestly, the cost structure can't afford that. So we have to do that. So we say, what are you most excited about? This concept that we call the collaboratories at UCI, which is how we put data to work to maximize the value proposition around data. And we say it that way is because data is different than other types of assets. If I take the example of a hospital bed, if there's a patient in the bed, it's creating revenue. If it's empty, it's a cost, right? With no offsets. But data works different. I can take a data set around our patients, for example, and I can use it as a continuous improvement opportunity for things like quality and safety. I can use it to define clinical decision support tools that are presented to the clinician to make a better decision for the patient. And I can also put it in a form that a researcher is using it to do translational research around a grant that they've done. So I've taken one data asset and I've created 3 value propositions, right? So it is a scalable value proposition model that's really different, in terms of thinking then about your business strategy. So the concept around the collaboratories, and the one in healthcare is called the Collaboratory for Health and Wellness, because it's not just about sick care, but it's also about how to stop people becoming patients in the first place by focusing on wellness strategies, is how do we think about the data that is generated in the health system, that's generated outside the health system. For example, those are where Apple Watches, Fitbits, or Rings, and maybe use diagnostic services like Forward Health. And how do you take that data and really then create an ecosystem and the data platform that can support the ecosystem, say, how do we help people make better decisions for themselves? Because each of us have to make our own decisions, and the health system should be a way of supporting us, right? I like to use the example of, you may have a financial advisor that helping you get to your financial goals that you have set for your life and your family. Well, why isn't my primary care physician positioned to be a health advisor to me to get to the goals that I have around being a healthy individual who can live the life that I want to live? That's the kind of relationship that I want, powered by data, to interact with my primary care physician. That's not the model we really have, but we are moving now. Certainly the data is coming into place for us to be able to make that. The healthcare professionals are starting to retrain to use a lot of this data. And you're now having the retail players like CVS and Amazon come into this healthcare space, who are going to redefine what it means to be a health consumer interacting with a primary care function which may be a very different way than maybe the way that I grew up. So I think you're seeing that data is the facilitator of a lot of change that we're going to see in healthcare. And that's what I'm excited about, because at the end of the day, at the end of that are individuals who have better options to stay healthy or to manage their chronic care conditions in a way that they can live the life that they want to live, which is what everyone wants at the end of the day.
So Tommy, speaking of retail, I had the privilege of seeing you speak on a panel at Becker's, and one of the topics that came up was the impact of retail on the healthcare space. And, a lot of folks I meet on the health system side talk about how, well, we're competing with retail now. How are we going to keep our market share and all that? But I think you had a really unique perspective around, well, actually, there's a major lack of access to primary care in the communities. And in fact, there's a CVS in every street corner. Maybe we should, see value in them standing up primary care clinics so that maybe they do fill a gap that the healthcare system can't meet right now anyways. So I thought that was a very refreshing and a very alternate perspective. Kind of curious how you think about navigating that environment today, given that you are on the health system side. Are you more of a collaborative then? Is it a maybe, depending on certain scenarios? Love to get your take.
Yeah, so I think if you're a delivery organization, right, you have to see that these trends are changing. And at the end of the day, it starts with the customer, right? That's what Philips taught me. Because you remember, Philips, I was in the healthcare side of the business, but there was a whole set of colleagues who were consumer, selling television, shavers, and I learned a lot from them on what customer insight really meant. And healthcare is not a customer insight driven industry. I can say that I've lived through a couple decades of it. We're not. But as retailers get involved, customer insights and customer understanding is going to be much more a part of the game. And so whether I'm coming in here as a healthy individual and wanting to make sure that I'm making good choices to keep me healthy, or whether, I'm pre-diabetic and my doctor said I need to make lifestyle changes, or it's just not going to be a good future for me, and I'm going to start to make those changes, and I just don't even know where to start. We're going to see, these types of understanding of cohorts at much more detailed levels, getting to personalized medicine. Then that's where healthcare is going. So delivery organizations have to figure out, how do I fit into this? Am I going to try to compete with it? Am I going to try to partner with it? How do I make sure my value proposition is not compromised or minimized in the way that this gets set up? And so, I use the analogy, Josh, when you and I were in the same room, it's like, I worry sometimes that from the healthcare delivery organizations, it's kind of a boiling frogs syndrome, where the degrees of freedom we have to operate and create profitability for ourselves, the temperature just keeps going up and up and up. And the bigger frogs can survive a little longer, but ultimately you're going to see what happens to the smaller frogs, and maybe you're going to see a round of, both closures and acquisitions. We're already seeing some of those. But ultimately, everyone's going to have to adapt to this new world. And from my perspective, from Tom's perspective, the more consumer-driven it is, the better it is for our society.
Makes a ton of sense. I do want to go back to the topic of AI and data. I'm kind of curious, when we talk to digital leaders on the healthcare delivery side today, there's a huge focus, as I'm sure you're aware, on specifically, ambient listening to automate documentation. There's a lot lately around generative, especially around how do we let every clinician start their notes with a draft, especially when it comes to patient portal messaging and trying to cut the inbox. Those seem like more obvious things folks are talking about today. I'm kind of curious, what do you see as some low-hanging fruit on the healthcare AI side that maybe folks aren't talking enough about lately?
Yeah, so I think, if you look at where the internet took us over, 30 years, we had to get our own personal experiences with it, like our productivity hacks first. And I think that's where a lot of us are with AI. Like, we're fooling around with, generative AI tools, and we're doing this and we're doing that. And it's, planning my next vacation, figuring out how to clean up my inbox and help me manage the flood of emails. And then we get confidence in it. We start to then work at kind of process of workflows and finding ways to automate them. And in some cases, I think we're going to see things like robotic process automation on the back end of a lot of healthcare, kind of get to the place that we thought we was going to get to 5 years ago. I think we're going to see a lot of attention on the clinician burnout issue in terms of what can we do, right? Whether it's the first pass of notes, or whether it's to automate patient responses. We saw an interesting study recently come out, talked about, sending follow-up messages to patients, by the human, by the generative AI tool. Quality and understandability was equivalent between the two, and empathy in the email, the generative AI tool won, right? Because they don't have bad days. They don't feel overworked. They just kind of do what they're supposed to do. So I think that's gonna lead the way to them more trust in, okay, we can control the way these tools come into the environment. And then I think we'll start to see more tools that facilitate clinicians making decisions. And look at radiology, right? They've always been on the forefront in terms of using the next wave of technology to improve the quality and the throughput of what they do. And AI has been no different, right? They've been using it to take the easier cases and try to automate them to the 90% level. They're trying to take the more complex situations and actually create tools that allow them to identify things that go past what the human is able to identify, right? And I think we're just going to find that rolling throughout the let's say the clinician community, where if you look at which fields have been the early adopters, they're using these things now, and down the road we're going to see other types of specialties start to use it. And when the closer it is to life or death situation, the longer it's going to be. We're just going to have to accept that comes with the healthcare equation.
I want to ask you also about the concept of the co-pilot. So when I think about kind of low risk industries, let's say Netflix for making recommendations of film and TV, or even just like conversational agents for your telco, support chatbot. I'm okay if everything's automated. There's no human in the loop because the stakes are really low. It's okay if mistakes were made. But right now, my gut is that in healthcare, when it comes to direct clinical care and clinical decision-making, you're almost always going to have a clinician in the loop, and it's only going to be a co-pilot because of, the risk of getting it wrong. I'm kind of curious, do you feel the same way, or do you feel like we will get to the Star Trek endpoint where there is a fully autonomous clinician on the other end and, there is no human in the loop. They are the clinician. How do you think about that and the future of AI in healthcare from a clinical point of view?
Yeah, so I think it's a long way off, and I think there's a bunch of really good reasons. Let's not forget that, as we talk about the United States, it is the most litigious society in the world. Will really hold this particular aspect back. Now, you go to other parts of the world, and again, in my global business experience, there were a lot of times we brought innovations into countries like India first because the regulatory environment was a lot more friendly to bring things in. And matter of fact, I was just talking to someone right before, about a week or two ago, talking about some of the interesting things that they were doing with AI in places like India and Singapore, because it was just a friendlier environment, right? So this is very interesting, right? Because you're going to see some of these tools that come into place in other parts of the world and maybe provide for better care in other places versus the U.S., where our societal construct make these things come into place a little bit slower. But I want to put a second side to your question. We always talk about the co-pilot being the pilot, in the doctor setting. What about the co-pilot that is the patient's that's working with the patient? Kind of like the worst part of raising kids from my perspective was being co-pilot teaching my kids to drive. Talk about the most stressful. People are like, what's the most stressful part of raising a kid? Teaching a kid to drive and being the co-pilot and feeling like you're completely out of control. But, you provided a good co-pilot experience, like that truck coming up on the left. Well, what about co-pilot for me, the health consumer, working with me, giving me those types of recommendations and decisions? I get that today in let's call it Gen 1 with my Aura Ring, when it says, hey, you've been sitting for a long time. Is it time to get up and stretch your legs? Or, make a walk around the block. I think co-pilots for the patient, one, it'll be consumer driven. Two, I think if it then gets supported by the health system for, hey, we're going to start to give you these tools, make these tools available to you on your phone, which is in your pocket, for your waking hours of the day. And it's going to keep you healthy. And it's not just going to be about exercise. It's going to also be about sleep. And it's also going to be about nutritional choices. And it's also going to be about stress level management. And so I think co-pilots, we need to think more broadly than it's just about the doctor or the nurse, but also could very well be the patient that maybe takes the patient who visits our health system 6 times a year and we get them down on the visit twice a year because they just spend a lot more time making healthier choices.
I love it. Al and I are big on the idea of Copilot for patient and engaging patients throughout their whole journey. And then now I'm thinking about like Copilot for your life. I'm thinking of like her and a walking Phoenix now. Like, I don't know how far away we are from that, but maybe I don't want that. I don't know.
Being an engineer by background, back to where Alan started, right? It's, there's kind of a construct for how you think about problem solving when you're trained as an engineer, and so logically, when I think about like my health situation, it's like, all right, so I go to visit my primary physician once a year. That's what the plan pays for. And I go in and they take my blood pressure. Rating means absolutely nothing from the standpoint of, am I healthy or not? And so I would much rather have a blood pressure cuff at home and figure out a routine to take it. Just like, having data about my sleep. So it's like, I think about like, the outcome is I want to be a healthy person. I want to have, good mobility, not feel limited in any way. My primary care visit really doesn't help me. I mean, it gives me a checkpoint, right? And I can bring, a dozen questions of things I've thought about over, the course of the year. It's like, I want to ask about this, and should I be concerned about that? It's my expert system that I go against, but it doesn't really help me manage. And I think that's kind of like, I differentiate now between the sick care system and the healthcare system, where we need to have a lot more focus and bring a lot more innovation to the health care, keeping people healthy, keeping people who become in the category of a patient to the lowest risk, and limitation orientation that we can get them to through self-management and better, decision-making on a day-to-day basis, not rely on the once-a-year visit, to which I can't even remember what I talked to my doctor about last year, because at the most, maybe I got a summary, or maybe I took some notes, but that's it, right? Versus data points every day, which I get on myself to basically say, am I trending in the right direction? Trends mean a lot. So, but again, can you get every person to think that way? We sure hope so someday. It certainly would help our healthcare system here in the U.S.
Yeah, I love that. And that's actually a great conversation that you had on one of your podcast episodes around healthcare and sick care and preventative medicine. I want to chat to you a bit about podcasting. You currently run the Digital Squared podcast. You've also previously hosted the Gradually, Then Suddenly podcast. And with Digital Squared, you are meeting with leaders to discuss technological, cultural, and societal trends that are shaping our world today, giving, the implications that we're living in an increasingly digital world. Hey, my question is pretty broad, but why do you podcast? What do you love about it? What keeps you going?
Because I want to be cool. Yeah, no, I think, again, most of my career has been drawn to the challenge of something that hasn't been done before, right? Or even stepping into a role. What could you do with this role that would be unique and different? I might be the chief digital officer, but I also have been asked to kind of make this university uniquely different in what we do or how we do things, right? And so one of the things I recognize from the platform I've been giving here is there's an opportunity for thought leadership and branding around what UCI stands for, is by taking my role and getting out there and really talking about where the world is going and bringing thoughtful people into conversation, right? So that's where the idea came from. And so, I think of it as a way of branding UCI in terms of one of the institutional leaders is out there talking about how technology and data are shaping the way that the world is going to work for tomorrow. Right? Because that's what we do as universities at the end of the day. We create the future, right? Our research pushes the boundary of discovery. It creates new knowledge. And then we disseminate that knowledge to our students through teaching or through our industry collaboration. So all I've done is created a platform to be able to talk about those things more using the relationships that I have or that the university has allowed me to create and say, let's talk about these things, because my job is to get UCI thought of as being one of the most innovative universities in the world. And so we got to talk about these things. And so, some of the things, one of the podcasts you'll see come out actually talks about the downsides around AI and what we need to be concerned about, because that's just as important as the upsides. And so I just saw it as one of those unique opportunities to say, let's do something that's kind of different, because I didn't see a lot of colleagues doing this from, these types of roles. And let's make it meaningful to shaping what people think of when they think of University of California, Irvine.
I love it. Tom, the last question. So we have what we call the Fast 5 lightning round, which is 5 rapid fire questions. But just before we get to that, you mentioned previously your priorities for growth today are expanding your footprint, expanding access, expanding research, and expanding partnerships in the community. You're also on the board of Ocean, and I'd love to find out more about why you feel that Ocean is important and what you're doing today to really shape the future for tomorrow in digital transformation in healthcare.
Yeah, sure. So thank you. This is a great topic to talk about. It starts with a little bit of a story about transition from Philips into the university. So my last role at Philips, I was involved in what we called emerging markets at the time, right? These are places like China and India that were third world from a healthcare perspective, but really trying to jump the curve by using a lot of technology. And my job was to build the businesses, sustainable businesses in those markets. And so when you go into those kind of third world healthcare markets, you see a lot of underserved, right? I mean, the quality, for example, of a radiology read between being in Beijing and being 50 miles out Beijing, like, it was like 3 out of 4 items were missed if you were just 50 miles away from a city center. And then I came back to the US and I landed at the University of California, and California is obviously a very diverse state, 40 million citizens. And I saw the same third world healthcare system within my own country that I really never saw before. And so through a set of events, I found my way to the Ocean Board, which is an organization really that is built to study and understand and bring better tools to those that are underserved in the U.S. healthcare ecosystem. So its customers are community FQHCs, critical access hospitals. And what they do is they have a special relationship with Epic, the EHR company, and they run a multi-tenant service to provide Epic to those clinics, right? So you're talking about a first tier tour priced and implemented at the places where people are receiving, kind of the lowest quality care. And then the wraparound services that allow essentially to bring the quality up of that, and done in a multi-tenant model with a single patient identifier. So the people in this part of our healthcare system have a single identifier so we can understand where they move. And so Ocean, having 7-8 million people, it's basically 1 out of every 4 Medicaid patients in the U.S. are represented in your database. So when we were going through the pandemic, for example, and studying things like vaccine hesitancy, right? Or we look at, kind of compliance for chronic diseases in these underserved populations. Ocean's data is, bar none, is unparalleled, through anywhere else in the country. And so I've been working with them for several years to basically help them understand how to build a data strategy that both creates through the collaborative, which is now over 1,000 facilities across the U.S. in blue and red states, and how to create a consortium to be able to push best practices so clinics that are better performing, serving these populations, share their knowledge to the other ones who can use to improve. They created advocacy plans, so give this part of our population, our underserved population, more voice in Washington. So earlier this year, we actually ran our board meetings in Washington, where we met with staff from the White House, key members of Congress who were, pushing through creating legislation for the continuation of services and dollars going to underserved communities for healthcare, better healthcare options. And so, it's part of this kind of access to healthcare, quality access for every American that I recognized working internationally, came back to the U.S. and realized that we had this problem right here in our own country. And I've dedicated my board time to helping Ocean really build themselves into an organization that helps this community get better healthcare.
Yeah, I love it. So Tom, just be mindful of your time. We're going to flip over to the Fast 5 lightning round. So just 5 rapid fire questions for you.
Go for it.
The first question is actually personalized for you, but do you feel that the TV show The Office misrepresented Scranton, Pennsylvania?
Good questions. For your viewers, I grew up outside of Scranton and went to high school inside Scranton. It does a pretty good job representing Scranton, the better parts.
Yeah, that's awesome. Question 2, what is your favorite cuisine?
So 4 ethnicities and 4 grandparents, but Italian is the go-to.
Yeah, love it. Question 3, would you rather have super strength, super speed, or the ability to read people's minds?
Super speed. Reading people's minds, things like would come with a lot of baggage.
Right. Love it. Question 4, what is something in healthcare you believe that others might find insane?
How much disconnected information there is in the actual care that they receive.
Yeah, I love it. Just given your perspectives on data, that makes a lot of sense. Last question that we have, Tom, if you could travel back in time to any event or moment, what would it be and why?
That's a tough one because there are so many interesting things. I think I would travel back to the industrial age and really understand how the leaders, both in government and in industry, thought about the world then. Because that was, a big transformational time in both, the manufacturing, but then also in when electricity came and it changed the way that you could think about. I would love to, there's some great stories you can follow historically about that. I would love to go back and get into the minds of the presidents we had, the people who worked in Congress, and, the industry moguls like the JP Morgans and the Henry Fords and the Carnegies of that era. And just to get to know how they thought about the world at that point in time, because they shaped so much of the way that our world works today.
Yeah, I love it. Well, Tom, that's unfortunately all the time that we have today, but I want to thank you again for coming on the show, spending some time with us, sharing your wisdom. For folks listening, you can find Tom on Twitter at Andriola_UC. And that's a wrap for this episode of The Digital Patient, hosted by SeamlessMD. You can follow us on Twitter at SeamlessMD. And if you like the podcast and you want to learn more, visit www.seamless.md. Tom, again, thank you so much.
Al and Josh, thanks for having me today.